Okay, so in our today's session, where we are going to discuss some theory and related MCQs for dental ANET, the topics that we are going to cover are the ones which are asked most frequently in the exam. That is age estimation, primary versus permanent dentition, and TMJ. From these topics, MCQs are coming, so we are going to cover them. All right. So first, let's start with age estimation. So for age estimation, like this, image-based questions come to you, where based on the diagram, you'll be asked to identify the or guess the patient's age. All right. So this way we can, in this diagrammatical manner, we can divide the age group into prenatal dentition, the dentition during infancy, the dentition during pre-childhood or early childhood age or preschool age group, late childhood, and adolescence. This way we can divide them into multiple age groups. All right. So if we see this way, during the prenatal, before the birth, around 5 months or 7 months in utero, you see developing or initiation of the deciduous dentition's calcification that has taken place. At birth, what is important that we need to remember? At birth, can everyone see this bluish colored teeth calcification which is taking place in this image? The
Yes,
bluish
sir.
color. Okay.
Yes.
But
Yes,
Yes,
sir.
sir.
this area, you have white color. So remember, in this image, the blue color is for deciduous teeth, and the white color that you see, as you can see here, white are for the permanent dentition. So what landmark is at birth, or birth is landmark for what development? That is, at birth you'll have first evidence of calcification for the first permanent molar, both upper and lower. So if you're given the image like this, where you see initiation of the calcification of the permanent tooth, only one or two dots you are seeing, that means that is the time of birth. All right. So that is one. Then next age group, that is around 6 months plus or minus 2 months. So 6 months is time where first deciduous teeth starts erupting. All right. Usually the first teeth to erupt are central and lateral incisors. So around 6 years plus or minus 2 months, you get the maxillary centrals and the mandibular centrals as well as mandibular laterals erupting. As we go further, at around 9 months plus or minus 2 months, all of them, the central and lateral, maxillary, and mandibular incisors erupt. All right. So if you see age group, age of eruption for the maxillary and the mandibular central incisor is, for mandibular it is 8 months for central and 13 months for lateral, and 10 months for the central and 11 months for the lateral maxillary incisor. So this is the age group. So at around 9 plus or minus 2 months, we can say all of them erupt. Last incisor to erupt, if you want to know, for the primary dentition will be the mandibular lateral incisor, which is around 13 weeks, sorry, 13 months of age. Okay. So if image comes like this to you, where the only the centrals are appearing to be erupting, no other deciduous dentition has erupted, the age group will be 9 months. Then around 1 year. 1 year is the time where you will get the first deciduous molars to erupt. All right. So if you see the deciduous molars that are erupting, that is 16 months for the maxillary and 16 months for the mandibular first molar. So 1 year plus or minus 3 months is around 15 to 16 months, you can say. So that is where, if you see this, just the permanent molars, permanent first molars are erupting, it is 1 year plus or minus 3 months. Going forward, 18 months plus or minus 3 months. So 18 months plus or minus 3 months is where you'll see or you'll notice eruption of both the canines and the second molars which are erupting. So if you see the age of eruption for the canines, 19 months for the maxillary deciduous canine and 20 months for the mandibular deciduous canine. All right. So that is around 18 months plus or minus 3 months, you will see eruption of the maxillary and the mandibular canine taking place. And at around 2 years plus or minus 6 months, we'll see the second molar erupting. All right. So if it is 18 months plus or minus 3 months, you will see eruption of the mandibular and maxillary canine. And at around 2 years plus or minus 6 months, you will see mandibular and maxillary second molar. Now, why I'm telling you this through images is because previously it was used to ask like at let's say 20 months or 24 months which molar erupts or which tooth erupts. Now directly this image will come. You'll get this image in question and they'll give you 4 options: 2 years plus or minus 6 months, 3 years plus or minus 6 months, and you'll have to identify. All right. So if the mandibular and maxillary second molars are erupting at the time where all other deciduous molars and canines and incisors are erupted, the age will be 2 years plus or minus 6 months. So till now, is it clear to all of you how we are estimating the age based on the images? Everyone?
Yes, sir.
Yes, sir.
Okay.
Yes, sir.
Now going to the next stage. Now here till 2 years plus or minus 6 months, all the deciduous teeth have erupted. They've emerged into the oral cavity. Now two similar images are there. Here you can see where all the deciduous teeth are there. They have erupted and they are in dentition. Both these images have been asked at separate time in two different exams, and both the options were there. Then so what is visible here is all the teeth are in occlusion. All of them erupted. All of them are in occlusion. But how we can differentiate whether it is 3 years plus or minus 6 months or 4 years plus or minus 6 months is the crown completion. If you see the maxillary central and lateral incisor, permanent central lateral incisor here, if you see here the maxillary and mandibular, the crowns are not completed. If we talk about 3 years, the crowns of the maxillary and mandibular central incisor are not yet completed. But when you go to 4 years, crowns of the central incisors are completed. So if you see the central incisor and lateral incisor with incomplete crown, while all the deciduous dentition are in occlusion, the age will be 3 years plus or minus 6 months. But in the same condition where all of them are in proper occlusion, they've erupted, but the crown of the incisors have completed, then the age will be 4 years plus or minus 9 months. So the difference between these two images are clear to all of you?
Yes, sir.
Yes, sir.
Yes, sir.
Right? If you see this, no, incisors, maxillary and mandibular central lateral incisor, the crown completion age is 4 to 5 years. So even if it is asked to you directly at what age does the crown gets completed, it will be 4 to 5 years for both of them. All right. Shall we now move forward to the next age group, students?
Yes, sir.
Yes,
sir.
sir.
Okay. Now, again, between 4 years and 5 years, in both of them, you will see crown completed for the central incisors. But after 4 years, that is around 5 years, you will see beginning of the root resorption for the central and lateral incisors, maxillary and mandibular. So if it is asked you that at what age does the root resorption for the maxillary and mandibular central incisor starts, it is between 4 to 5 years. Depending on what option is given to you, you can choose. 4 to 5 years is when the resorption for the central and lateral incisors are starting. So if this same images are there, this two, how will we identify whether it is 4 years plus or minus 9 months and 5 years plus or minus 9 months? What is the factor that we'll have to decide from?
The root resorption.
Correct. So this as such we see 3 years, 4 years and 5 years. Remember at 3 years, 4 years, 5 years, all the teeth have erupted. They are all in occlusion. Differentiating between 3 and 4 is crown completion of the central incisor, and differentiating between 4 and 5 years is resorption of the deciduous central incisors. Got it?
Yes, sir.
Students?
Yes, sir.
Okay, next. After that, we have 6 years age group. 6 years, simply we can remember, if the maxillary and mandibular permanent first molars are erupting, they are known as the age group will be 6 years. It is simple for everyone, nothing else to identify it from, just eruption of the maxillary and mandibular first molar will identify the condition as 6 years plus or 9 months. Clear?
Yes, sir.
Yes, sir.
Yes, sir.
Yes.
Because the permanent first molar, both the maxillary and mandibular, are erupting at 6 years of age, they are known as 6-year molars. If it is asked you in exam, which molar is known as 6-year molar, it will be the first permanent molars, maxillary and mandibular, because they are erupting at age of 6 years. Clear?
Yes,
Yes,
sir.
sir. Yes,
Okay.
sir.
So if you see kind of summary for the, because permanent teeth have started erupting now, so all the deciduous teeth have erupted. So if you see summary, first the central and lateral incisors erupted, that is A and B. Then before the canine erupted, we had eruption of the first molars. So first central and lateral erupted, then first molar erupted, then canine erupted, and then the second molar. So if you see the sequence of eruption, it is A, B, D, C, E. That is central incisors, then lateral, then the first molar, then the canine, and the last tooth to erupt, deciduous dentition, is the second molar. Remember, this is the sequence of eruption, and also this teeth exfoliate in the same sequence only. So if it is asked to you what is the sequence of eruption for the primary dentition, it is ABDC. And what is the sequence of exfoliation for the primary dentition? It is again ABDC. Is it clear, everyone?
Yes, sir.
Yes, sir.
If you remember this that we just now discussed, no, you don't have to mug it up. You'll remember that central and lateral erupting first, then before the canine, first permanent molar is erupting. Before the canine, first molars are erupting. Then canine, and the last ones to erupt are second molar. So ABDC is the sequence both for the maxillary and mandibular primary dentition, but the maxillary lateral, maxillary first molar, and maxillary canine, they erupt kind of earlier than the mandibular. So this can be asked to you, between maxillary and mandible, which one is erupting earlier? So maxillary B, D, and C, they are erupting earlier than the mandibular ones. Okay, if this is the timeline, so mandibular A is erupting first, then maxillary A, then maxillary B, and this is the sequence. So is it clear what I'm trying to tell you here? Maxillary B, D, and C erupt earlier than the mandibular B, D, and C. Everyone?
Yes, sir.
Yes, sir. Yes,
Okay.
sir.
Yes.
Now, all the deciduous teeth that we saw are known as primary teeth, but uh, there is one term known as succedaneous teeth. Succedaneous teeth means the teeth that take place of the primary teeth. Okay, so on the place of the central incisor, permanent central incisor will erupt. On lateral, permanent lateral. On canine, permanent canine will erupt. Now, in place of the first molar, first deciduous molar, first premolar will erupt, and on place of second molar, second premolar will erupt. So this 5, 1, 2, 3, 4, and 5, that is central, lateral, canine, first and second premolar, they are succedaneous tooth because they are succeeding the deciduous teeth. Whereas the first, second, and third permanent molars, they are not succedaneous teeth. Got it?
Yes, sir. Yes.
Just sorry for interruption. So what we can say is all the succedaneous teeth are permanent teeth. That is 1, 2, 3, 4, and 5. All of them are permanent teeth, but all the permanent teeth are not succedaneous teeth. Are you getting what I'm telling you? 6, 7, 8, although they are permanent, but they are not succedaneous. So this can be asked you in exam, which of the following is not a succedaneous tooth? And the option will be 3, 4, 5, and 6. What will be the answer?
6.
6.
All right. So yes, this was still early childhood age that we saw. Now coming to the late childhood in the mixed dentition stage. Next age is 7 years plus or minus 9 months. So this is the time where you see eruption of the central, maxillary, and mandibular incisors. All right. Then at around 8 plus or minus 9, you will see eruption of the lateral incisors. So if you see the age group for the central and lateral, 7 to 8 and 8 to 9 for the maxillary, 6 to 7, 7 to 8 for the mandibular central and lateral incisors. Okay. So if you see just central incisor erupting, it will be 7 years plus or minus 9 months. If you see the lateral incisors erupting, it is 8 years plus or minus 9 months. Next, 9 years. What will you see at 9 years? In 9 years, both the centrals and laterals have erupted and they are into occlusion. Okay. At the same time, this canine 3, 4, and 5 have not yet started erupting. So that will be 9 years plus or minus 9 months. Now, when you see mandibular canine and maxillary and mandibular first molars, first premolars erupting, that age group will be 10 years plus or minus 9 months. So if you see the age of eruption for the first maxillary and first mandibular premolar, for first so this age group you'll have to remember, it can be asked to you. First maxillary premolar 10 to 11 years, first mandibular premolar 10 to 12 years, and the mandibular canine is 9 to 10 months. All of them are in this age group, 10 years plus or minus 9 months, where the mandibular canine and maxillary and mandibular first premolars are erupting. All right. And at 11 years plus or minus 9 months is when the maxillary canine is also erupting, that is 11 to 12 years, and maxillary and mandibular second premolars will also erupt, that is 10 to 12 years. So this is very important to remember. Age group for or age of eruption for canine, first premolar and second premolar, that is 11 to 12 for the maxillary canine and 9 to 10 for the mandibular canine. If you remember, mandibular canine erupted along with the first premolars. Okay, so first premolars 10 to 11 for maxilla, 10 to 12 for mandible, and the last one are second premolars, that is 10 to 12 for the maxillary premolar, 11 to 12 for the mandibular second premolar. So this 6 age group, any of it can be asked to you in exam, that what is the age of eruption for this, and you'll have to answer. Is it clear to all of you, students?
Yes, sir.
Yes, sir.
Okay. Then next is 12 years. 12 years is when the second molar is erupting. So it is known as 12-year molar. Got it? The one which was erupting at 6 years was 6-year molar. One which is erupting at 12 years is a 12-year molar. So this is 6-year molar. First molar is known as 6-year molar. Second molar is known as 12 years molar. All right. Then at 15, all the teeth have erupted. They are fully in occlusion. At around 21 years, that is in between the age of 18 to 25, we'll see eruption of the third molar, and around 21 years, if they erupted, they will be in full occlusion. Okay, this is about the all the image-based questions which can be asked to you based on this age estimation. All right, so just now, like we saw, sequence of eruption for the primary dentition. What was the sequence for primary?
A, B,
A, B, then
DCE.
DCE.
TCE was age of eruption for the primary dentition, either maxilla or mandible, for all of them. Okay, but for the permanent dentition, the sequence of eruption is different for maxilla and it is different for mandible. Okay, so if we see for maxilla, 6, 1, 2, and 4 is it is there only, it will be there, and 7 and 8 will be sure they are the last ones. But in some patients or in some people, canine may erupt before second premolar, and in some second premolar may erupt before canine. So this is more common, 3578, 612, 43578. But in some cases, canine may erupt late. So 612, 45378 is the sequence of eruption for the permanent dentition in maxilla. And in the mandibular dentition, 612 is common. Then either canine erupts before the first premolar or the first premolar erupts before the canine in mandible. So if you remember this, in this, the canine was erupting along with the first premolar, but the permanent, in permanent, this canine had not erupted. So 612, then either 34 or 43, followed by 57. Second premolar will erupt last only. So in maxilla, if you see, the change is between the second premolar and canine, and in mandible it is between the first premolar and canine. Canine is there always in change. Okay, but in maxilla the change is for second premolar, and mandible the change is for the first premolar. So you remember this sequence of eruption for the permanent dentition, everyone?
Yes, sir.
Yes, sir.
Yes, sir.
Okay. So if you see, the last tooth to erupt for all of them is 8, third molar. So the last tooth to erupt is known as ultimate tooth. And the one which erupts before the ultimate tooth is known as penultimate tooth. So which tooth is penultimate tooth? Remember, the second molar is known as penultimate tooth to erupt. Clear, everyone?
Yes, sir.
Yes, sir.
Okay, we'll see some questions based on this. Okay, which of the following is not a succedaneous tooth?
16.
1-6.
Because why?
Yes.
It's the first permanent molar.
First
First
permanent molar,
permanent
which
tooth.
does not take place of any
It does not
deciduous
go.
tooth. है ना? Very good. Last permanent succedaneous tooth to erupt.
Second.
What will it be?
E.
Option B.
The second premolar, right?
Med-
We are talking about maxilla. All right. What is the sequence? Most common sequence of maxilla we are seeing? 6, 1, 2,
2, 4,
4,
3,
3,
5.
5.
4, or 4, 3, 5, 7, 8.
Seven.
Am I correct?
Yes.
No, sir. Mandible.
Sir,
Oh, sir, that's
That
is
mandible.
mandible. Maxillary
That's
3,
mandible.
5. Yeah, 5, 3.
Okay, 435 or 453. But among this, what is more common? I told you, first one, 612 435 78. So 435 78 is the most common sequence that we are following. All right. So what is the last one which is succedaneous within them?
Second premolar. Maxillary second premolar.
Second premolar will be the last permanent succedaneous tooth to erupt. If the options were mandible, in mandible also it will be second premolar.
Second
Remember,
premolar.
either it is maxilla or mandible, in both of them, the last succedaneous will be
second
premolar. All right. And if overall, if it is asked to us, which of the following is penultimate tooth, then
second molar.
Second molar.
is the penultimate tooth. Very good. Okay. In this, tell me what is the age group?
7 years plus minus 9.
Why 7 years?
7 years.
So because only the centrals have been erupted.
Yes. 6 have erupted. There is 6 years is gone, and 7 have erupted. Okay, so age will be 7 years plus 9 months. Clear, everyone?
Yes, sir.
Yes.
This, what is the age group?
5 years.
3 years.
5.
Why 5 years? I had told you this, all the teeth are in eruption, and
3
we
years.
have to see the central
4
incisors. Central
4
incisor
to
crowns
5
are not
years.
completed.
Not completed. 3 years.
Crown not completed of central incisor. What it will be?
3 years.
3 years.
Age.
Yes.
What is the age of crown completion for the central incisor?
4
4
years.
years.
Okay. So here 4 years have not reached. Alright, but central incisor have started erupting. All the teeth are in, central incisor have started forming and all the deciduous dentition are in occlusion. The age group will be
3 years.
3 years.
3 years.
Mm.
Here, what will be the age group?
10 to 11 years. 10 years, 9 months. 10 years, 9 months.
Option B.
Because the
10
first
years.
premolars have erupted
Premolars.
and only the mandibular canal is erupted. So the age group will be
10 years and 9 months.
10 years
10
plus or minus
years, 9
9
months.
months. Here, what will be the age?
4 years plus minus.
4 years plus minus 6.
5,
4 years plus
5
6.
we are calling it 4 years because
Completion.
Completion of the
because
crown.
crown is completed. Very good. Okay, now same can be asked you in the form of OPG also. So
4 to 5 years.
why 4 to 5 years?
Because all deciduous roots
Because
are still present.
All the
Without
crowns
form.
are completed of the
Roots is
parent permanently.
permanent central incisors
See, permanent centrals have not yet erupted. Okay, all of them have not erupted. Even the straightforward thing, if you see, no, even the permanent first molars have not erupted. They are yet to erupt. This is the bone. The permanent first molars have not yet erupted. Hence, we can go for the answer of 4 to 5 years.
4 to 5.
Okay, if you see, identify the teeth. This is E, is D, C, B, A, B, C, D, E. All this deciduous dentition is there. All right, the teeth which are developing below them, 5, 4, 3, 2, 1, 1, 2, 3, 4, 5. These are 6, 7 is yet developing. All right, this is E, B, C, B, A. Then A has exfoliated, B, C, D, E. All right, this is 1, 1, 2, 2, canine, canine, 4, 5, 4, 5, 6, 6. All right, 6 have not yet erupted. Hence, we are going for the answer of 4 to 5 years. Clear?
Yes, sir.
Yes, sir.
Yes.
Are you
Yes.
sure? If you are in doubts, you can ask me. Okay, I hope it is clear. Now, last question for this. What will be the answer? So, what are we seeing here? The permanent laterals have erupted. 1, 2, 1, 2, 1, 1. This 2 has yet started erupting. Okay, 6 have erupted. But the root completion of the first permanent molars has not yet taken place. What will be the answer? So, what cannot be the answer? Let's assume. Can 12 be the answer?
No, sir.
No, sir.
Because at 12, second molars also will erupt. Can 11 be the answer?
No, sir.
Because the premolar would have erupted.
Premolar.
So, we are confused between 7 and 9. Whether to go for 7, whether to go for 9. Okay. So, one important point that we can see is the roots of the molar are not yet completed. And if you see here, at around 9, the roots will not be completed. Okay. Sorry, at around 9, root will be completed in the mandibular molar. But if you see at 7, the roots are not completed. So based on that, we can say that because the roots are not completed, the answer will be 7 years.
One.
Got it? Everyone?
Yes, sir.